Hello, my name is Dr. Mark Tadrissi. I'm an endodontist here in Charlotte, North Carolina, and some of you may ask, well, what is an endodontist? An endodontist is a dentist who's gone to additional years of training, typically 2 or 3 years of additional training after dental school to learn specifically about root canal therapy. And that's all we do all day long. And typically nowadays all of that training is done with a microscope, so that has become the standard of care in endodontic therapy. So make sure that you are getting the best care possible by seeing somebody who uses a microscope. We use certain technologies in our practice that make a big difference in the way we render care to our patients. We try to stay on the forefront of all the new technology that's out there. The cone beam 3D imaging is one of the latest and greatest. It's been around for a while, but it has been recently over the years perfected and fine-tuned for endodontics. And what that does is that allows us to digitally, three-dimensionally dissect a tooth on the computer once we've taken an image of your tooth, and allow us to look at your tooth internally and see where the canals are, if there are any missed canals, if you have any defects within the tooth like resorption, if there is potentially a fracture somewhere, although we can't see the fracture on the scan, but we can sometimes see it in the bone around the root. We'll see a decrease in the bone support. So it just gives us a lot of information prior to doing treatment, and sometimes, many times, it enables us to come up with a diagnosis prior to having to go in and do exploratory work like we used to have to do years ago. A good majority of the cases we can do that now with taking the 3D scan. So we'll eliminate that need for an additional treatment and saves you the expense of going into the tooth. So I think the biggest take-home message here is when you are instructed or mentioned or told by your general dentist that you need to have a root canal, and they're going to typically refer you out, you want to make sure that the endodontist that you're going to see has been microscope trained, and hopefully they're at a level of technology in their practice that will help make your visit pleasant, efficient, and less costly. Hopefully with the technology it avoids unnecessary treatment. Thank you for watching. Again, I'm Dr. Mark Tadrissi with Ballantyne Endodontics here in Charlotte, North Carolina. Thank you for your time.